Makeba, good afternoon.
Good afternoon. There is a debate within the medical community about how to best screen for cervical cancer in women with the PAP test, the HPV test, or both. New results from the largest retrospective analysis of cervical cancer screening strategies in women 30 and older showed using both PAP and the HPV test together detects more cervical cancers than either test used alone. In fact, the Quest study found that 1 in 5 women with cervical cancer were missed by screening with HPV alone. Here to talk about the importance of cervical cancer screening and the study results is study co-author Dr. Marshall Austin. Hello, doctor.
Good afternoon, Makeba. I'm happy to have a chance to talk to your audience about this subject.
Absolutely. Now, first, doctor, tell us more about the study and its findings.
I was fortunate to be a co-author on this study with Quest Diagnostics, one of the largest commercial laboratories in the United States. We had access to a unique, huge database of over 8 million women screened across the United States for cervical cancer. We also had within that database data on hundreds of women who actually did develop cervical cancer. And we were able to look at the performance of the different screening tests, both the pap smear and the HPV test. And one of the exciting findings of the study, what emerged clearly was that the highest level of protection from cervical cancer was when the women were tested with both the pap smear and the HPV test together. The pap smear has been medical history's most effective cancer screening test. It has decreased cervical cancer from being the leading cause of cancer deaths in women at the time of World War II to being now a relatively rare cause of cancer in women or cancer deaths. And the good news from our study is that now we have an even higher level of protection that is available, and that is testing with both the pap smear of women who are actually developing cervical cancer. Women get screened because they don't want to get cervical cancer, and because if they do get cervical cancer, they don't want to die from cervical cancer. Cervical cancer is the key endpoint. And this is the first study that had large numbers of women within this huge database that actually were developing cervical cancer. And it showed clearly that the highest level of protection was from testing with both the pap smear and the HPV test. As you said earlier, we found that nearly 1 in 5 women developing cervical cancer had a negative, misleading, false negative HPV test result, and that the greatest likelihood that a woman developing cancer would have an abnormal finding and a red flag to her doctor that she needed additional testing. Additional diagnostic testing was when both the pap smear and the HPV testing were offered.
It definitely shows why it's better to have both tests done together. Now, can you also share with us what the difference is between the PAP test and the HPV test?
The pap smear is a direct visual test, a microscopic test. We look at cells scraped from the woman's cervix by her doctor into a collection vial, and then we look at the cells under the microscope, and we can often see direct evidence in the cells of the development of cervical cancer. In contrast, the HPV test is a complementary test, but a different test. It's a test for the virus that causes cervical cancer. When the two tests are used together, there is the highest likelihood of an abnormal test result that will alert the doctor that the woman needs additional diagnostic testing.
Yes, it does sound great for making sure that women stay protected against cervical cancer. And lastly, doctor, where can women go to get more information?
I generally suggest that women who would like more information should talk directly to their doctor or their healthcare provider for recommended information on cervical screening, and they can also refer them to a number of useful websites.
Thank you so much. And for more information on the new study results as well as the PAP and HPV test, definitely talk to your healthcare provider for more information. You can also visit www.papplushpv.com. Thank you so much, Doctor. It's been a pleasure.
Thank you.
Have a wonderful day.
You too.